Okay, good morning, everyone. My name is Mika Marumoto, the Executive Director of Asian Forum of Parliamentarians in Population and Development. I was ordered to go brief by my boss, but let me just, on behalf of the AFPPD, I would like to express my appreciation to the conference host, the Morisa, UNFPA, and HelpAge International. Thank you so much. And I'm honored to introduce Honorable Professor Keizo Takemi today, our own chairperson of the AFPPD. Professor Takemi is a member of the House of Councillors in Japan and a former Senior Vice Minister of Health, Labor, and Welfare. He's the chair of AFPPD and the co-chair of the Standing Committee on Active Aging. Currently, he is a chairman, Special Mission of Committee on Global Health Strategy, the Liberal Democratic Party in Japan. Professor Takemi is a current member of the UN High-Level Task Force for the ICPD, International Conference on Population and Development. Professor Takemi is a very visionary leader, going many steps ahead of us, and aging issue is one of them, and he comes up with great ideas and effective solutions. And today, Mr. Takemi has chosen this venue, this conference in Hanoi, to share with us his new vision, Asian Human Wellbeing Initiative. Thank you.
Thank you, Mika-san. Thank you very much indeed. I'm so delighted having this wonderful occasion to talk about how the Asian parliamentarians see the economic implication of aging. And actually, the meeting is so unique, which consists of not only those NGO peoples, but also the ministers and house speakers and parliamentarians. And those are the complex of the players has a wonderful function to network and also to generate the idea together, and has a real function to encourage the policymakers to get into the really right direction. So thank you very much indeed having this wonderful occasion to deliver the speech for our experience focusing my own country, Japan, as the most advanced nation. Partly, we did a good job, successfully overcome so many aging-related issues. But on the other hand, we have also made a lot of mistakes how to do it. Therefore, please carefully listen what I'm talking about. Firstly, this is the population trend of the Asian and Pacific region according to the latest World Population Prospect in 2015, released by the UN Population Division. In this case, the Asian and Pacific region is defined here as East, Southeastern, and South Central Asia. Here we can see the trend in the elderly population, 65 years and older. In 2010, there were 300 million people aged over 65. The elderly population will keep on increasing by 100 million every 5 years in this region. 100 million. It will reach 900 million in 2050, almost triple the number today. The youngest age group, the less than 14 years old population, was the largest in 1995. It's 1.1 billion. It's the peak. And then they began decreasing. The working population, 15 years to 64 years, will peak in 2045 at the 3.2 billion and then will decrease. Are we ready to take care of this large number of very old people? The need for long-term care for the elderly will be proportionate to the number of older seniors. Since the Asian and Pacific region's population is large and is aging rapidly, it's very important to know that there will continue to be a large number of senior people in our region in the future. This is the reason why we need to recognize our challenge now and start preparing. This is the dependency ratio of the selected Asian and Pacific countries. The dependency ratio, as you may know, is calculated by dividing the dependent population of young age, less than 14, and elderly over 65 by the working age population of those 15 to 64. The higher dependency ratio, the higher the burden imposed on the working population. In Japan, the dependency ratio decreased sharply after 1950 and reached the bottom from 1960 to 2000, when there was strong economic growth. This can be seen as a demographic dividend of Japan. During this period, Japan was able to develop a system to deal with aging. In 1961, the universal health insurance coverage in Japan was achieved, and simultaneously, universal pension system was achieved in 1961. At that time, Japanese per capita income was only $4,120. And the long-term care insurance system was introduced in 2000. Therefore, it was very lucky for Japan and our people. We could have 40 years to prepare for aging. But what I am talking is the speed of aging in Asia. Many Asian countries are facing into the much more speedy aging. Because Japan could enjoy. But on the other hand, the most Asia and the Pacific countries were having a high dependency ratio around the 1970s due to a growing number of babies and children. Then the dependency ratio started to decline sharply, and now many are hitting the bottom. But after the dependency ratio hit the bottom, then population aging pushed up the ratio rapidly. The length of the benefits of the demographic dividend is short, so the graph can be described as a V-shaped arc. This argument of U-shaped arc, like Japan, or the V-shaped arc in the many Asian countries, is important when designing the measures for aging individually and collectively in this region. Now, I want to talk about the speed of the aging continuously. This is a very, very interesting graph which shows the speed of each country of aging. Aging happened quickly in Japan. The speed of aging defined as the number of years required for the percent of the population aged 65 and over to rise from 7% to 14% was only 24 years from 1970 to 1994. But compared to France, the 115 years, and the US 69 years, and the UK 45 years. However, in Asian and Pacific countries, this speed is expected to be even faster than in Japan. South Korea and Vietnam will take only 18 years, the Singapore and Thailand 20 years. To cope with the rapid aging, Asian and Pacific countries need to build the social security system in parallel with establishing universal health coverage, which should cover the medical service, healthcare, the nursing service, and pension system. So we had experiences how to cope with those aging societies through the various dimensions of various policy makings. It was a really hard experiences for ourselves. Parliamentarians faced so many political risks in order to reform it. But in Asia, many countries, the policymakers are facing much more the serious political positions in order to create new package to cope with their own speedy aging. Now, this is the dynamics of aging, the wave of aging in Asia. This table shows the categories of countries classified by the magnitude and the speed of aging. The speed is scaled based on the ratio of the elderly population over 65. The expansion of demand for healthcare services for the elderly will begin in industrialized countries and will gradually spread like a wave to affect the middle and low-income countries. International health worker migration often involves the movement of workers from middle and low-income countries to industrialized countries. But it is anticipated that the demand of healthcare services for the elderly will eventually increase in middle and low-income countries as well. And simultaneously, I want to emphasize another serious change of the disease structure in this region. This graph shows the estimate of the growing number of the cases of the non-communicable diseases as a cause of death. Deaths from non-communicable diseases are anticipated to increase due to aging. To cope with this problem, achieving universal health coverage is necessary since it can provide the medical care services, including prevention, in a prompt and fair and appropriate manner. The patients with non-communicable diseases need to be treated continuously at an affordable cost. Oh, excuse me. The aging and the Sustainable Development Goals. Therefore, the UN Assembly accepted the Sustainable Development Goals, the last assembly, especially focus on the Article 9 of the SDG 3, Article 3, ensure the healthy lives and promote well-being for all at all ages. Of course, without the universal health coverage, we cannot overcome any issues related to the aging. And now I'm talking about where is the place for living of the older population. This is a very unique data. You know, the half of Japan's elderly are living independently, alone or only with his and her spouse, without children, 50%. This proportion is increasing rapidly, but even now it is much lower than that of Western countries such as Germany, 19%, or the US, 70%. In most of the Asian and Pacific countries, significantly fewer elderly are living independently, and they live with children. It's quite fortunate. However, already 1 in 3 Chinese and Vietnamese elderly are living independently, 1 in 4 in Indonesia, and 1 in 5 in Thailand. The rapid migration of young people out to the cities leaves their parents alone back in the rural areas, you know. Now, in general, since families tend to live together with parents or relatives, it seems reasonable to assume that the need for in-home service is high in Asia. Japan's policy has been to extend the facility-based care for our senior students to meet with the increasing demand for both health and welfare services. This resulted in relatively weak community and home care service, and consequences include the higher cost, long waiting list for those facilities, and loss of workers to look after the parents at home. and more importantly, dissatisfaction of the senior citizens. Hence, I wish to make it clear that the overemphasis on the facility-based care should be avoided in Asia. This is also very unique data. Where is the place of death for elderly population in Japan? In 1951, I was born in 1961. At that time, 82.5% of the elderly people died at home. 82% died at home in 1951. But now, 2009, only 12.4% died at home. The increase in deaths at the geriatric hospitals and other facilities means increasing expenditures, which eventually place a heavy burden on the public finance and may not be sustainable. After some reflection on overemphasis on the facilities, Japan had to alter its policy to place more importance on in-home services, such as the integrated community care system in 2014. If we cannot successfully carry out this new challenge to generate the socially integrated community services at home, both for the medical services and also the elderly care services, it will cause another serious difficulty for our own people in their own community life, including younger generation. And also, the cost is continuously increasing, and our budget, I'm sure it's collapsed. And then, on the other hand, in home services, after some reflection on the overemphasis on the facilities, Japan had to alter its policy to place more importance on home service. And then, on the other hand, in home service, even though we emphasize the importance of the in-home services, another headache is coming out. Because of the elderly generation's burden is increasing at home to take care continuously for their parents. Therefore, it is obviously important to countermeasure policy to support these families so that they can secure the flexible employment opportunities. And this is another very important aspect of the aging. Eduardo already mentions the importance of the healthy life expectancy. The WHO started to measure the healthy life expectancies all over the world. Japan did the same thing since 2000, and we noticed that quite fortunately, the Japanese healthy life expectancy, both male and female, is now the #1 in the world. But on the other hand, we noticed that the gap between the healthy life expectancy and the life expectancy. In the female, 12 years, the male, 9 years. What does it mean, the gap? The gap means if the gap is widening, I'm quite sure that the more elderly population needs more healthcare services and more elderly care services, and increase the more cost of the economic and the social. And then the younger generation have to share the much more serious burden and lose the cause of the social dynamics. This is the very negative vicious cycle. How we can overcome this vicious cycle under the aging it's quite clear. Extension of the healthy life expectancy should be given the highest priority. But simultaneously, how to reduce the gap between the healthy life expectancy and life expectancy should be given the priority issues as well. And now, we have to think those aging issues not only in individual countries. We have to think the aging issues in the international levels. In the past, most of the parliamentarians and policymakers tend to think their own aging issues in only a domestic context. But now the aging is a common agenda in Asia as a whole. We have to think how to cope with aging beyond the national boundaries and the country-to-country collaboration. The one reason is the labor forces issues for the elderly care services. Many Asian countries are expected to become aged society before establishing a system for providing basic medical services, and so it is necessary to construct a system whereby medical and nursing care can be provided integrally, not only on the facilities but also at home. It would be advisable to follow the stage experienced by Japan, building the medical services before the nursing care. Japan had placed importance on the health facilities, which raised the medical care expenses. Asia would be better served by designing its nursing system based on in-home services. Considering the institution in Japan, where the lack of the long-term care, the human resources is worsening, especially in the urban area. Most of the local area in Japan, aging has already started and nearly completed. But the new, much more speedy aging is now taking place in the urban area, especially Tokyo. It's really unfortunate thing that my own constituency is the Tokyo metropolitan area. And then, considering the situation in Japan, where the lack of the long-term care, the human resources is worsening, we will secure the human resources by accepting trainees from the Asian countries who will then be able to cope with the rapid aging in their mother countries in the near future. Nursing care industries, including the facilities, equipment, materials, and human resources, are beginning to develop in Asia. Japanese long-term care providers can support the human resources and equipment development, including the nursing care, the robots. Now, many the Japanese industries, like Toyota of the automobile industries and the Panasonic, are now trying to develop the home care robot. I'm quite sure in the future we can use the healthcare robot at home to take care of the elderly persons. This is not only a dream. This is the reality we are having in the future. And these mutual benefits and mutual beneficial efforts are being discussed at the cabinet level in Japan. And we have launched the Asian Health and Human Wellbeing Initiative just 1 month ago, with the two pillars just described now, building a long-term care system and establishing an economic partnership agreement for future nursing care personnel. Now, I want to summarize my own conclusion and focusing on our Asian Health and Human Wellbeing Initiative. The policy goal, responding to an increasing number of elderly people, make the whole Asian region a society of health and longevity where the people live their own lives based on their own health. The second, the guarantee the healthy elderly people opportunities for continuous employment by increasing healthy life expectancy, make it possible to secure the certain level of income and ease younger generations' burdens by maintaining human resources and productivity and carve a way for sustainable economic growth. I'm quite sure this is the common goal beyond the national boundary in Asia. And then I want to just explain that the conceptual framework, the expansion of demand for healthcare services for the elderly will begin in industrialized countries and will gradually spread like a wave to affect the middle and low-income countries. The demand for healthcare services for the elderly will eventually increase in middle and low-income countries as well. It is essential that the health workers who have left their own countries be given the option to eventually return to meet the demand within their home country. Not a one-way immigration policy, but rather a circulation policy that enables the coming and the going of the workers between countries is needed. The international community should provide the support for the achievement of universal health coverage in middle and low-income countries in a way that takes into account the aging of those societies, a country-specific approach, and should also promote the collaboration among the countries, an international cooperation approach. One example of this is the Asian Health and Human Well-being Initiative, which Japan is promoting now. And then, it is essential that the health workers who have left their own country be given the option to eventually return to meet the demand within their home country. Not a one-way immigration policy, but rather a circulation policy that enables the coming and going of workers between countries is needed. The international community should provide support for the achievement of the universal health coverage in middle and low-income countries in a way that takes into account the aging of those in the society. As I mentioned, on the other hand, this is in the Asian Health and Human Well-being Initiatives. I really hope can collaborate with our partnership in Asia. This is the framework of our Asian and Human Well-being Initiative. The strategy, the method is support for the building universal health coverage based on the ownership of the recipient countries. The ownership must be given the highest priority, but recipient countries should develop their own capacity of the policy making and the policy implementation and take the very important initiatives to cope with those the own aging issues under the public and private collaboration beyond the national boundaries. And second, support the Japanese nursing and related business under the public and private partnership. In order to encourage the private sector's mutual collaborations, the government should conclude those are the memorandum for collaboration for aging. Now, the second framework is just like that, intergovernmental collaboration. The framework for the cooperation, and action for cooperation, promotion of research, and promotion of circulation policy for human resources. And the support for the private sector is very important in order to create sustainable collaborative system among the Asian countries for aging. The coordinate the Council of Asian Health and Human Well-being Initiative. The private sector, governmental organization, and related ministries will establish the council to support the overseas operations. And funding, JICA's overseas investments and loans, as well as Cool Japan funds and the Japanese Bank for International Cooperation's loans will be introduced depending on the types of activities. And assessing the needs to support the assessment of the needs will utilize the existing ODA mechanisms such as the JETRO's Business Support Center offices or the JICA's offices. Now, as you see, the big wave of population aging is coming to Japan. But the big wave will come one after another to you as well in Asia. All countries in this region have no choice but to prepare well and overcome the challenge wisely. Since the demographic change is foreseeable, we can predict and prepare. To this end, we must work together by sharing experience and collaboration with one another. I would like to once again express my deep thanks to the organizer of this wonderful occasions. This is the wonderful occasion to share those other experiences as knowledge how to cope with aging. But also this networks has a real political function to create the real political momentum on which the policy maker can decide and implement the real policies in order to cope with aging in Asia as a whole. And also we always encourage our policymakers to think the aging issues not only in own individual country, but in the much wider context beyond the national boundary. I really hope that our friends here can make a difference and create the real function as a catalyst to generate the new idea in Asia as a whole. Thank you very much for your patience.
Thank you, Professor Keizo Takemi. Brilliant as usual, passionate as usual, strategist by heart and by experience. I think the experience of Japan and the experience of and the vision of having aging not seen as solely an individual country issue, but is seen as an issue that is affecting all countries in the world, but in particular Asia, I think it's very timely. And Professor Takemi, once again, thank you very much for your excellent words. May I ask Gottfried to make the announcement? Unless there is any question for Professor Takemi, would you be willing, Professor Keizo, to take some questions? Yes. Do we have a microphone? Yes. Maybe you can.
Thank you very much. This is Atik from Bangladesh, Dhaka University. I am very much happy and grateful to this young man, Professor Keizo Takemi. Fortunately, he has a long experience on aging. So he mentioned that in Japan and some other countries, the challenge of aging is much more than tsunami. And particularly the younger generation, they will face much more challenge about this issue. So in Bangladesh, we have huge number of older persons side by side, huge number of younger persons. But the younger one, they are not aware, sensitized, active about and preparation about how to challenge their old age. Can I request Professor Takemi that we can develop a volunteerism involving the students of college and universities? They can take at least 6 months to 1 year preparation, how to address their aging so that they can pass their active and healthy aging, the volunteerism. Because at that time, we need not to have any robot for healthcare. Thank you.
You know, the most important approach to cope with aging is to investment in youth and encourage them to have much more babies and encourage to them to strengthen their own life basis on which they can much more smoothly take care of their own children, take care of their own parents at home. As I mentioned, we made a lot of mistakes. In 1970, I just mentioned that our aging has just started. And then the late 1980s, we had the first comprehensive gold plan, which was the comprehensive policy package how to cope with aging. But it was too late. Now, the many Asian countries are now getting much more speedy aging. It's a really unfortunate thing that you have only a limited years to prepare for aging. Before you have become much more wealthy countries, before you are achieving the universal health coverage, already you are having the really large size of the elderly population. I'm lucky I'm a politician of the Japanese. But those other policymakers and politicians in those the Asian countries, we are having a much more speedy aging, having much more real difficulties, not only for policy-making difficulties, but also the political risks. Therefore, you have to be hurry to prepare how to cope with aging. And always, when you think of the how to cope with aging, how to create most efficient policy package, which is consists of the pension system and also the universal health coverage and also the new employment policies which can give the occasion for the elderly population to work continuously and guarantee the income certain levels, and then extend the independent life basis for the elderly population as long as they can. This is a very important policy package. We can overcome the aging-related issues. In this process, my Bangladesh friends just mentioned that the younger generation, like students of the university, should be the very important driving force to create longer-term policy making for your own countries, the aging policies. Aging policy is not only for the aging people. Aging policy is also for the younger people. That's the reason why I really respect your initiative, having the students of the university to learn how to do it. Thank you very much.
Thank you. May we take a couple more questions? There is one behind you, Dr. Boykan, before. May I?
Thank you. I am Fuzilatun-Nessa Indira, Member of Parliament of Bangladesh. All of us, we know that the elderly population is sharply increasing. As the number of aging people is increasing, but the health services are not increasing. On the other hand, the aging people movement and the other things, they are very much limited because their movement is very much limited. It is not possible for aging people to go to the hospital for health care. So it is better, as you mentioned, that it is better to provide the home-based services. But I think that for elderly, health services for aging people are not enough. But but in this situation, the way the aging people is growing, so we'll have to think about their health care health promotion and health-related issues. But resources, physical facilities, and training of the health worker also limited. In this situation, it is not possible to deliver home-based services, but some way we'll have to manage it. So my question is that, as the structural and other facilities, including services, medicine and other things, it will take long time, but for the time being, for short time, what can be done for health promotion, health care? Thank you very much.
Thank you very much indeed. I can't understand what sort of difficulties you are having in your country, the Bangladesh. Those are the human resources for the medical care services and nursing care services are always limited. However, the important thing is that policy direction. As well as the policy makers do not, intervene the policy making for the elderly populations. It is obvious the facility-based services are growing much more than the in-home services. We have already experienced. And then the policymakers should have the strong leadership to intervene the policy making and the trend of the elderly care services and keep the momentum on which the home services care can continue. Without political intervention, I don't think that the trend is happening. And then, in Japan, when we faced the first phase of the aging in 1970, most of the elderly people rushed to the hospital and stayed there for long days and sometimes years. And medical expenditures spent quite a lot and could not control and manage the healthcare expenditures. And then we introduced the long-term healthcare services in 2000, and we tried to move the patient in a hospital to the facilities of the elderly care services in order to contain the expenditure for the national budget. But still we could not do it in an efficient way. Now most of the elderly people stay in a hospital and stay in a nursing home and spend a lot of money and deteriorated our budget deficit in a significant way. Therefore, you should not follow up the same process which we had. Therefore, under the limited resources, including human resources, you have to keep their original position to encourage the in-home services and through the primary health care services under the universal health coverage. So under the SDG 3, we mentioned that the guarantee for the healthy lives and human well-being at all ages. This means very important. We decided to use the universal health coverage as the most important concept of our healthcare decision making in this SDG 3. So we promised to achieve the universal health coverage by 2030. No one left behind. And then in this process, you always can take into account for the elderly population, which is increasing, and take care of them at home as possible as you can through your own primary healthcare services. I think this is the most efficient and sustainable approach for your own country, I think. Japan could not do that. Therefore, we are now facing very serious difficulties. I belongs to the LDP majority party of Japan. So always we are claimed and criticized so many interest groups of the service deliveries. The interest groups, once fixed up their own position of the service delivery, they want to protect their own interest under the existing system. And then we parliamentarians and the political policy makers recognize we have to reform the system itself fundamentally, but always faced very serious difficulties from the interest groups. And coincidentally, most of the interest groups are original supporter of my own party, LDP. This kind of a contradiction, I'm quite sure that you are wise parliamentarians have to avoid in the future.
Professor Takemi, Boy Khan from Pakistan. I just putting two things. There's a lot of things to say. There are two things. Health is basically, aging now is a political issue. Is it possible that all these parliamentarians who are here, that we approach the countries that they have a group that is elected or selected 5% of the parliamentarians on basis of being elderly, so that they can represent the elderly interest in the parliament? This is not possible, but we have female, they are represented compulsorily. For example, in the Constitution of Pakistan, 30% of all parliamentarians are to be female. So it could be 5%. Secondly, this is an economic issue. You have a budget for education, you have a budget for health. Why don't we have budget for aging? This could be also done through the parliamentarians. This is a difficult question, but if the parliamentarians were to really go for it, then maybe in the long term, we will not see all that darkness that we are seeing today, because it is the political will of a nation that actually cleans up the road before you move ahead.
What you are talking is quite right. Under the very speedy aging in Japan, especially in my constituency, the Tokyo metropolitan area, we have a large size of the elderly population. Especially, most of them belongs to the baby boomers who born after the World War II. And those baby boomers' large populations has a very, very political power to decide because of the size of the population. And the younger generations, most of the youngest, around 20, they don't have any concerns, not only the aging issues, but also for the politics itself. The voting rates is totally different from the elderly population. Elderly population tend to go to the voting place and vote for the election and the candidate. But the younger generation will not do the same things. So it is inevitably the parliamentarians tend to pay much more attention on the aging population rather than the younger generation. This is quite wrong and really make a mistake. Therefore, recently, even under the speedy aging, under our Prime Minister Abe's leadership, we are now trying to remove the financial resources for aging to the investment in youth. But this is the politically very risky decision. But we have to do it. Therefore, always every country has a political structure which is closely related to the population structure as well. Thank you.